Sounds great. All right. Well, thank you again, Jim, as always. And I think the topic is always, there's always a great topic, a combination of you picking them and people sending information in. I'm going to be slightly New Yorkerish and sarcastic and say there is no such thing as a simple anterior case. I think they're a lot more complicated um, than we think they are. And I'm going to try to work through some real basics, but at the same time, I want to kind of be clear that there is not just one simple system for everything. And I think we have to kind of figure out how we approach things. So I have some basic systems. I think I've covered them over, the years with different webinars and so forth. But I think it's important to realize that how we apply the basics, I think, are what separates us. So let me kind of phrase that so everybody really gets my point. You could be the best ceramist or the best denture setup person or the best at any of the things that we do digitally. But if you don't know how to apply those techniques or concepts to the cases and the humans that you're working on, I think it becomes a little bit more challenging. So I think it's important for me to say that there is no such thing as just simplicity. Also, before I go too far, let me just remind everybody that the next webinar that I'm going to do is going to be on April 30th. And I will do this with one of my clinical partners. So Dr. Bernadette Saba will be the clinical partner for this one. I'm kind of looking forward to it. Um, I couldn't even begin to tell you how many crazy clinically involved cases. So we probably meet 2, 3 times a week to discuss them. And I thought it would be really nice for the audience that pays attention to these to kind of see behind the scenes of how we work through things together and how the input of a teamwork is so critical for us to be successful today. So I hope you will join us for the April 30th. And I think maybe I'll even go to her office and do it this way. It'll be real clinical environment kind of an event. So simplified layers and how to create them. So I want to be clear. I don't think there is a really simple version of anything, but I do have systems and concepts that I try to use. One, looking at nature is really where it all starts for me. Understanding the ceramics and the materials themselves. And when I'm teaching hands-on courses, a lot of times I'm talking about opacities and translucencies. And it's kind of mind-boggling, and I'll say it to you, Jim, in the sense that as ceramists, and I'm focusing on ceramics for this lecture, um, there's a lot of talented people out there, and talent is part of it, but a true understanding is really what matters so much, right? So when I'm teaching a hands-on course, a lot of times I'll ask the ceramist, what's the opacity of the dentin you use? And almost everybody looks at me like I'm crazy, like we're supposed to know that number. I know that I put this powder here and this powder here. And my challenge with that, or the challenge that we face with that, is really that how do you know what to use and when to use it, especially in different environments, right? So I have a full coverage restorations. I have 1.5 mm to work on. And what powders do I need to fill that 1.5 mm? Or in today's world, where I'm using much more micro-layered materials. Maybe I'm using a zirconia or a lithium disilicate. I'm only layering 3, 4, 5 tenths of a millimeter. Well, if I don't understand the opacity and translucencies of my materials, I can't transition from one to the other easily. It all starts from the base, and the base is understanding the powders in the systems, whether you're fully layering or micro layering. And I believe you can't do great micro layering if you don't have good fully layering concepts. So for me, my basic system is simple. And I think I've shared this so many times. And I think we all know the phrase KISS, keep it simple, stupid, right? And I do try to keep it simple. I really try to, my base concept is the same for almost everything. The only thing that's physically changing each time is how much powder I'm using, which powder I'm using, why I'm using it, and then what material I'm putting it on. For me, most all my cases with lithium disilicate, with zirconia, I should say, I'm doing ceramic margins on, and this became part of the process from metal ceramics. I'm not doing it so much with lithium disilicate for several reasons. One of the main reasons is lithium disilicate margin materials don't really exist as well. And because of the low fusing parameters of the material, it's hard to fire much higher on them. But with zirconia and definitely metal ceramics, I should say with metal ceramics for sure, but also with zirconia, I'm doing ceramic margins. And the real important part of this is a concept again, right? A system. And here's where it gets a little frustrating for me. I can't tell you how many, I think my last course I just did was a month or two ago in Canada. And, during the course, I asked the question of what is everybody doing for their wash bake? And 12 people in the room, all, hands all up, and 12 different systems that were going on, right? Who put a dentin on and fired it high? Who mixed the dentin with glaze and fired it? Who used the liner material? Who doesn't do anything but sandblast? And everybody has systems right in place. And a lot of times those systems are kind of antiquated because some of them aren't based off real good science or information, and some of them just aren't helpful to where we want to go. So here's how I start every wash bake, especially with zirconia materials. I start them with either margin materials or liner materials. And the reason I start with those materials is one, because they're highly fluorescent, and two, because I can utilize them to create the base canvas that I want to utilize for my final layering. And I want to simplify my final layering, especially in today's world where we're doing much more micro layering. So I'm always using a higher chroma marginal material around the actual cervical and margin. I'm using a higher value marginal material to be more reflective with light, and then sometimes up and down the line angles. And that's really where I'll do it. It's usually 2 margins or sometimes 3. And this is my wash bake. Now, why is this bake so important? Because what this bake actually does for me is it sets up everything that I'm going to do. And I don't want to be sarcastic or mean-spirited sounding by saying a lot of the wash bakes that I see are just kind of goofy. They don't really make sense to me why people are doing them, because they're not doing anything better. Scientifically, you're not getting a better bond from it, and aesthetically, you're not getting a better place to start from. So for me, the start is always going to be here, where I could do everything that I want to do by creating chroma and value in the areas that I want to do it from. And once I've done that, it makes my next bake or my layering bake a lot easier, because really my bake standard is coming from nature. What do I mean by that? Well, look at a natural tooth. I've showed this picture a billion times, right? And you always notice that in the cervical third, the tooth has the most chroma and a decent amount of translucency. The middle third of the tooth is where you see the most value. And here's the one that I think people miss out on the most. It's not just about hue, value, and chroma. I've kind of changed that phrase because those are important things for understanding color. But for us, it's really about chroma, value, and age. It's really about what is the chroma we need in the gingival areas, what kind of value are we looking for, and what is the age and effects that we're looking to create in that incisal zone. And I think you all know those age and effects are much different for a 20-year-old patient compared to an 80-year-old patient. And our job is to know the difference and be able to see what's proper for us. But my wash bake, or my marginal bake as I call it, sets me up for that. How does it set me up? Well, I'm already increasing the chroma, which means I'm going to get a lot more light absorption in the cervical third, and I'm already increasing the value, which means I'm going to get a lot more light reflection in the middle third. And now it allows me the freedom to just work or worry a little bit more about that incisal zone rather than everything else, because the rest is done for me. So then I'll start in straight with my incisal edge. And if I didn't get enough support in my substructure, if you didn't design your substructure well, or they just made a thimble coping in the design center, not a problem. My marginal material will fill some of that space. And then I may use an opacious material, an opacious dentin, an EC material, depending on what kit you use, to extend my coping to the area where I can get the most support, where I don't want all the light just passing right through and you see that little end of the coping. And once I've used a little bit of an opacious material, then I'll just go straight to my dentins. And my dentins are going to be simple. I'm going to use a higher chroma dentin in the cervical third, and I'm going to use a higher value dentin in the middle third and up and down the line angle. So let's take an example. If I'm trying to build a 1, well, I'm probably using at least a 2, maybe even a 3 at the cervical third. And rather than using just A1, I'm jumping up, maybe B1 or OM3 or something a little bit brighter, because I want to increase that value in those areas so I can finalize my enamels later on and drop the value down, which is what the enamels will do. So I'll finish off that canvas. And again, remember, I've increased chroma, I've increased value. And then as I'm getting to the age of the restoration, I might do both. I might use a higher chroma, I might use a higher value, or I might just mix it with some translucent and create that wall of that canvas where I have chroma, value, and translucency towards the incisal edge. And that is kind of almost similar for me on almost every case that I do. By the way, if this was a monolithic case, what would I do? I'm sorry, a micro-layered case, what would I do differently? Well, you'd already have your chroma established here. That would be by staining. I would try to start increasing the value, probably with some staining, or my cutback would start in this area. So I can use the substructure material, micro-layered, as a monolithic cervically, but I want to start brightening up that material in the middle third, and I want to do my cutback starting in the middle third and then up and down the incisal edge. Okay, you'll also notice that when I'm building what I call my canvas, that I'm always kind of building that to the lingual of the rest of the final position. So basically it's the lingual wall. And what that lingual wall allows me to do is utilize that space for light absorption and effects. And whatever those effects are going to be, it could be mamalon materials, it could be opacious materials, it could be straight dentin, it could be nothing. It really depends on what effect I'm trying to achieve during that final restoration. And then once I've done that, I've set myself up to cover my final restoration with about 5/10 of a millimeter of enamel, which is the normal amount of enamel that we would use. And that's kind of my standard buildup, right? It's very basic. A higher chroma, a higher value, and then what kind of a translucency am I looking for in that incisal third? Problem is, if you take that concept and start bringing it into cases, it becomes a little bit more complicated than that, right? Because we're not just dealing with one tooth that we're trying to make look pretty in our hand or on the model, we're dealing with the human element. And when we look at our patient here, I think you can see right away that there's a lot of tooth issues going on. And I wish I could say, well, this is just a simple buildup. Is it? I'm not really sure it is, because I think if you're all probably shaking your heads right now going, uh-oh, this is a problem, right? You see the teeth flaring all over the place, some bad crowns in different areas, the roots are exposed, it's kind of a mess of a case, right? So it's nice to say, oh, well, I could do a simple buildup on this, but I can't until I've established what I've needed to do. So the layering is only easy if you plan all the substructure parts out properly. So in this case, we're going to do everything that we would normally do. We're going to do a little tooth setup, and Jen actually did this, so I don't like to take credit for it. And that tooth setup is going to be our future position to figure out what our subframe should be. Should it be metal? Should it be zirconia? Should it be lithium disilicate? What should be the material here? And then once we understand that, what we're going to do to replace those missing teeth. And in this case, they're going to be implants placed. So now you see where we're going already, right? Yeah, simple layering is the goal at the end. But before I get there, I have to really be aware of what I'm trying to accomplish. Also, you notice this with Dr. Savan. He actually took some pink shades right away because he knows we're going to make a provisional, and he wants me to kind of have an understanding of what the pink actually looks like, because it's obvious that we're going to need some pink here. And Jen made a pretty kick-ass provisional, if I do say so myself. That was pretty good. Pink's not perfect, but I always tell everybody we don't want the pink to be perfect now. Actually, just the opposite. I always want to make sure the pink is a little bit off at this point, because I want it to be better in the final than it is in the provisional. But this provisional gives us some information, right? It establishes the incisal edge position, and it also establishes where the pink needs to be, how much display we will have on that final restoration. So you see the doctor will prep out the teeth and capture the 2 implants that have been placed. We originally thought there were going to be 4 implants. There were only 2 placed. And part of that protocol is kind of a call that I would want to make as a technician. What do I mean by that? I'm going to go back because I didn't really plan on talking about this point, but I'm going to. So you see what's happening here when they're planning. surgeons always want to put, as many implants as possible in. And sometimes that sounds good. Sometimes I would argue that's a mistake. Whenever there's going to be pink involved in the restoration, I want as less implants as possible. And I'd really like those implants to be as far away from the pink as possible. So I could treat that cervical area more with the pink materials rather than having an implant in the way. So in this case, I'd say these weren't as ideal as I would like them. I would actually like this implant more over, maybe in the lateral position, and this implant more towards the distal or the cuspid position. That would allow me a little more freedom to create a more hygienic restoration at the end. I chose to go metal ceramic on this case for many reasons. Our last lecture was actually on metal ceramics, and it was kind of fun to do because I still do a lot of metal ceramics. We chose to go metal ceramics, and this is Keon's framework, so he gets the credit for all these great framework designs. The real reason we went metal ceramic was because that was the only really way to make this screw retain, to create some angled channels and still be able to get the support I wanted in the connector sizes and embrasure spaces for the final restoration. So framework was fabulous. Everything else was tried in and we made sure it was great. And then I went on to my ceramic, and I won't walk you through all the ceramic buildup except to tell you that I did exactly what I just said. I started with chroma in the cervical, value in the middle third, and some translucencies and effects that I felt were proper for this particular patient. Final restoration was placed. I think the doctor actually made a nice little video of him screwing that in the patient's mouth. And we did more than just that implant frame. You can see there were 1, 2, 3, 4, 5, 6, 7, 8 other units. So it was almost a full arch. And as that's being screwed into place, final restoration is now done. So was that a simple case? Of course not. It's a really complicated case. But in the end, was it simple? Yes. Why? Because of the pre-planning, designing of where the implant should be, the designing of where the tooth preparation should be, the designing of what substructure would work best for that scenario. And then after that, it's easy for me to simplify and say, I need chroma, I need value. What kind of effects am I looking for? How white and bright does the patient want it? And what's next? Next, obviously, will be the lower. This is the insertion day, by the way. So I don't have any finals yet. This is just a day that it got inserted. And that was just actually last week. So I'm looking forward to some finals on this case. And I think we're going to be doing the lower also. So that's metal as a material and a very needed material. Most of you who have paid attention to my webinars know that when I'm looking at my cases, everything starts with the face, and we'll work on this a lot more in the April 30th webinar with my doctor. Face, white, and pink. We want to look at what the face looks like, where the white belongs, and where the pink part belongs in the restorative if we need pink. We don't always need it, but we always want to support it so the aesthetics of the restorations work out properly. Shade selection, and this again, we'll go through this a little bit more in the next webinar, how we kind of work that as a team, and then the provisionalization based on the diagnostic evaluation and our wax up. From there, we see what we have. This is going to be a refractory case, so kind of an old school feldspathic refractory. I still do a lot of them, and I still think they're one of the best alternative restorations. And from a business point of view, and I hate to sound like a business person or a used car salesman, but I could tell you that a lot of the phone calls that I get in my office are from clinicians who are kind of tired of lithium disilicate veneers and look for something different. I get it. You can make arguments that the lithium disilicate is stronger, and yeah, I get it. But to me, that's kind of just a silly way to look at it. The goal is to choose the material that's right for that patient at that time frame. It's not about making your restoration last longer and doing damage to the intraoral environment, right? It's about making the restoration aesthetic, functional, sound, hygienic, all the things that you want, and making it last as long as it possibly could. How long is that? I don't know. And I don't know that answer because you don't know how long people's teeth last in general, right? People break teeth, people bite into things and crack it, people wear teeth, abrasion. I mean, there's so many factors that play into this. I'm not sure why, we think one molar crown should last 8,000 years, right? It should last as long as the patient needs it to last. And if it doesn't, we should be able to fix it and replace it without having to put an implant in. So for me, I'm choosing my materials based on that concept. So let's walk through the layering for this. Again, the same basic and simplicity. I have 4 refractory dyes. Abraham does all the refractory in here besides for a million other things. And always a fabulous job working with the cast. Look how nice, I mean, look at the tissue, and it's almost a pleasure to pick these up and sit down and start working on them. So back to the buildup. What am I going to do? Exactly the same thing. I'm going to create chroma. What is my final shade? Whatever it's going to be, I want more intense color in this area of the cervical. What is the final shade going to be? I want a higher value in that middle third. So I'm going to use something that's a little bit brighter. And then as I get to the incisal edge, what am I looking to do? It's going to be all about the age of the patient or the age of the restoration that I'm trying to make it look correct in that patient's mouth. So let me just kind of define these a little bit for you. Obviously, everybody knows the definition of chroma, right? It's a higher intensity of color. But what you really should be thinking of it as is not just really about the color. You should be thinking about as anytime I increase intensity of color, I'm making it more absorbing for light. So when the light hits an A4 as compared to an A1, more light is absorbed into the restoration, whereas when I hit it into light into an A1, more light is reflected from the restoration. And I've always said that value is really about absorption and reflection. It's not just about using OM3. It's really about understanding how light can be absorbed and how light can be reflected. When I get to the value area, I'm going to use something brighter in my materials. Why brighter? I'm not using it because I want the shade to be OM1. I'm using something brighter because I want something to be more reflecting. And the whiter the material or the brighter the material I use, the more reflection I get. You know, I always kind of get, I think mocked would be the right word, because when I teach in Europe, a lot of times the Germans especially always say to me, oh, Pisa uses the bleaching materials all the time. And it's kind of a mock thinking that every American just wants bright white teeth. Kind of true, but that's not why I'm using them. I'm using them because I'm looking to absorb color in some, or absorb light in some areas and reflect light in other areas. I'm using the material to my advantage. I'm not using it because I'm only trying to create a white, bright material. And then as I get to the incisal edge, it's really about a contrast of materials. I want some light absorption. I might want some light reflection. And I have to kind of make that determination as I'm looking at what I'm trying to achieve for that patient. How much translucency, how much reflection, how many mamalons, if I want them at all. I'll go to the dentin after that. What is the dentin going to be? Just like we said, chroma in the cervical, value in the middle third. Then I'll start transitioning from the value to the translucency in the incisal edge. And in this case, I went straight with a decent amount of translucency on my canvas. Why? Because the patient was young enough that I really wanted to create a mamalon-y look in their incisal edge. And I did that by just using mamalon materials. So over that canvas with the chroma, the value, and the translucency, I'm now just using my mamalon materials to block some of the translucency and reflect some of the light, and then allow some of the light to pass through in different areas. And you can see my mamalons kind of placed here where I want them to be. And the beauty of what happens with that is those mamalons are much more opacified materials. Some of them even have fluorescence in them. And everywhere that doesn't have mamalon materials, the light is able to pass through. So kind of like what you see here. So you can see where the translucencies are, and you can see where the mamalons are. And some of the light goes up into these areas, and some doesn't. It really depends on the effect that I'm trying to create from those mamalon materials. And that area is really this little area right here that I'm always kind of focusing on. So remember, here's my chroma, here is my value, here is my transition of translucency, and then I'm going to use some of those mamalon materials to hide that transition a little bit. Right? So it kind of looks like this: chroma, value, transition. Same all the time. So again, Jim asked me for a simple buildup. That's my simple buildup. What changes is the colors that I'm choosing, right? What's really changing for me is how much chroma I'm using, how much value I'm using, and how many mamalon materials I'm using. And that really just changes on the age or the effect that I'm looking to achieve throughout the case. Okay, after that, I'm going to shift to my enamels. And my enamels, I kind of treat with a similar mindset. Remember, enamels are really filters, right? They kind of filter out the light in the sense of a whiter enamel reflects more light, a more translucent enamel allows more light into the restoration, but also lowers the value of the restoration. So I kind of think through those all and what am I trying to achieve? And by the way, that's why a lot of times I'm picking a brighter material in that center third, because I know if I want to use translucency, I'm going to lose some of that value. So I want to make sure that I don't lose too much. I don't mind picking it up a little bit more on the inside because I can always filter it out more on the outside. So remember, enamels are considered a filtration system in my system, but they should be for you too. That's really what they do. They either allow the light into the restoration or the light to reflect outside from the restoration. So either one of those is fine. You just should know why you're using those concepts, right? What enamel am I choosing? And again, this is, I don't want to say frustrating, that's not fair, but as I'm teaching and I'm working with ceramics for, we've been doing ceramics for 10, 20 years, and I say, well, why did we pick that enamel? And a lot of times the answer is, well, that's the enamel that goes with that shade, right? A1, I'm supposed to use ENL, right? Or 57 or whatever your system is. But that's not really how it works. You should be thinking of, what do I want that enamel to do? Do I want it to reflect some of the light and keep the value up? Or do I want it to allow the light into the tooth to show off my dentines and my mamalons and my effects that I just put there? And by the way, that's no different in a full buildup or a micro layered buildup. It's the same concept. And that's why understanding the materials are so important. Do I want to filter out with that enamel that I'm putting on my micro layer buildup? Or do I want to allow the light to go into the micro layer buildup and utilize the lithium disilicate or zirconium materials that are underneath it as absorbing and reflecting materials? So the same concept for me all the time. I know Jim's thinking, this doesn't sound simple, but it is, right? Because the concept is not changing no matter how complex the case. That's why I'm kind of throwing in some different cases here, right? The first case I showed you was just a simple buildup on a single central. The next case I showed you was a crazy implant full upper arch. And now I'm showing you a 4-unit refractory veneer case. But think about it. My buildup hasn't changed. It's been the same buildup. Chroma, value, age, and effect. How am I filtering that out? And whether I'm using 15 powders or 4 powders, or 2 powders for that matter, I'm not changing the concept of what I need to do. I need to create chroma, I need to create value, I need to create incisal effects, and I need to filter that out with either some sort of translucency or whiter, brighter opacity enamel. But that hasn't changed for any one of the 2-3 cases I just walked you through so far. So finalized restorations, we'll take those restorations and we'll see the preface here, and we'll place those restorations in the mouth. I love this case. We did this case a few years ago, and I think I was heading out to Chicago when we were doing this case, and I told the doctor, I said, I need you to do me a favor and really clean everything up well, because you're only going to get the pictures of that day, and I'm not going to have time to get them later on. He was inserting it like the day I was leaving. And he did, right? Look at how nice as you slide that veneer and how great that tissue looks. And to me, that's like some of the best parts of dentistry, right? When we can put something in a patient's mouth and it looks like it belongs there. Now, is that papilla perfect? No, it'll fill in a little bit more over time, but look at how nice that gingival sits right on that feldspathic ceramic. So that's always like a nice feel when you see that. So we'll put our restorations in. You can see the patient is actually still numb, and you can definitely see that we're going to get a better fill in here in those little papilla areas. And everything is still open because this is day of insertion. But in the end, all the simplicity of what we try to do, chroma, value, create a canvas, mamalons, filter out, same. Whether it was veneers or whether it was a major implant case, nothing really changed. The concept of the buildup was the same. All right, let's go through one more buildup. And this one, I'll go into zirconia now, since we did metal, I did refractory veneers. I didn't do lithium disilicate, but again, the concept doesn't change for me. It's very similar. And in this case, we'll go through a zirconia case. So This is a very interesting case. Actually, I just presented this case in Chicago, not at Midwinter, at the SCAD meeting. I did it with one of my doctors, Miles Cohn, and we presented this at the SCAD meeting. It was I just finished the case right before the meeting, so it's an interesting case. But you can see on my tray that all the powders that I have laid out to work on this case, so you already know this is going to be a full build-up case, not a micro-layered case. And I won't go through every detail on this case because we presented this case for probably about an hour and a half between the two of us. I'm just going to kind of skip you through to the build-up part, but it's hard for me to kind of walk through it without telling you some of the challenges that went into this case and why we are where we are with this case. So this patient, young female, she presented because of the graying that she had after a root canal on that number 8 or the 1-1. And it wasn't at any of my offices. And whoever she went to, whatever the doctor or the dentist was that she worked with, basically saw a young girl, prepped out 6 teeth, put these horrible provisionals in, and sent her home. And she just kind of flipped out, right? She's like, what's going on here? I didn't realize this was going to be what happened. And there's so many things that we could pick on, and it's unfair. So I'm going to leave that out and just say that it was in a bad scenario. Well, she went back 2 or 3 times, had a few different sets of provisionals made. Shapes got a little bit better, but you could see that over time, the teeth underneath are starting to stain because the provisionals probably weren't sealed very well. And I think if you can tell that from the facial, just take a look at the lingual. I mean, horrible, right? Not only you can see the margins that are open, but you can see that the spaces at the proximal filled, and it's just a nightmare of a case. I think there's actually a lawsuit involved in the case. So by the time we took it over, you can see the open margins in the x-ray. By the time we took it over, it was kind of a mess. And we had to kind of evaluate what we were going to do. And part of what we did was realize that this could not be veneers anymore because the preps were so aggressive in some areas that there was really no enamel left to bond to. And unfortunately, not only did she probably not need all those veneers, now she needs full coverage restorations, which is a whole another nightmare. You'll also notice that the occlusion was pretty tight. So we also recommended some orthodontics. So just for evaluation, the patient actually had her original restorations. And I said I didn't bring any lithium disilicate in, but I'm going to bring it in now. I did not make these. These were made by the lab that worked with the previous doctor. But we said, you know what, let's try them in and see what they look like and evaluate if there's anything useful for us. And during the try-in, I think both the doctor and I looked at them and said, there's nothing useful for us here. This is kind of not a great scenario. This looks like what I always call bad lithium disilicate. And what is bad lithium disilicate? It has that blue-gray kind of look where it just doesn't really work very well. And this is really a lot to do about technique. I know I'm starting to do some work with the new Ambria to kind of, get it to the next level, and also understanding how to utilize your ingot selection with lithium disilicates is really, really critical. So if you don't do it right, this is what you get, right? This kind of blue-gray, trying to make it look white, that looks dead and fake, and so many flaws with it. So we already know that this is going to not be a veneer case anymore. It's going to be full coverage, but we do have to put the patient through ortho. So what we decided to do was go to a different material, and this is enamic, and I use enamic fairly often. I actually have a case on my desk right now that I'm using on. What we decided to do was give her some enamic, a nanohybrid material, veneers, while she was going through the ortho. And the reasoning behind that was because she was walking around like this and not very happy with it. And this has been going on for a year or two now. So our thought was, listen, we have to put her through ortho. It's going to take us probably a good 6-8 months. So why don't we at least give her some long-term provisional veneers that will allow her to feel a little bit better and look good while we're doing the orthodontics. And that was really what the plan was. So to do that, we use an enamic material. The enamic material is milled. And then basically these little thin veneers you see here are all just nanohybrid enamic material. Little colorization and staining, and then we'll place those, we'll bond those however we can in the mouth to whatever enamel is there. and then we'll put her in orthodontics for 6 months. We'll pull in those lower teeth so we can create a little more freedom in there. And once we've done that, we'll start taking the shades and cleaning up the preps and going through all the normal things that we would do. I did use the YZ material here, and I milled my copings in a 1M1 shade, a straight shade actually, because she had a brighter tooth, but it wasn't that bright, and I was going to pick that up in the coloring. So let's get back into the layering. You see what I have here. I have very thin copings, zirconia copings. You can see that they're already cut back from margins, and you can see they have a little bit of support towards the incisal area, so I don't have to extend my layering that much. My wash bake, I already told you, is fluorescence. Why is fluorescence so important? Because under different lighting, if you don't have fluorescence in your restoration, what you'll find out is that the restorations are dead. So although I think enamel is a really nice material for many reasons, for single unit implants and long-term, veneers, it still does not have fluorescence to it. And let me be clear, there are no materials we use that come with natural fluorescence. None in lithium basilicate, none in zirconia, none in metal ceramics, none in nanohybrids. The only materials that have fluorescence are ceramics, feldspathic ceramics. So our job is to figure out how to incorporate those in. So for me, it's either marginal materials, which are my favorite, or it's liner materials, which are also highly fluorescent. And as you already know, because I walked you through this in the first case, I'm doing my wash bake, as everybody calls it, and I'm doing that with my marginal materials to do exactly what I wanted to do before. Create my opacity and create my value in the areas that I want to create it in. And if you look at this under fluorescent light, you should notice how much fluorescence I get in the areas where I want it to be. I don't want my fluorescence up in this area. I want the majority of my fluorescence kind of right here. This is where you get the majority of fluorescence in nature, but I'm going to get a little bit of a run up and down my mesial and distal line angles there, just to help me push the light in the areas that I want to push it in, and that's usually on those line angles. And I'm using powders for this. I want to be clear. Again, these are margin materials or liner materials for me. If I was in a more micro build-up case and I didn't have the ability to do that, then I might go to fluorescent stains, or maybe using some glaze paste in the beginning of my build-up to start to create that fluorescence in a much thinner area. But if it's a full build-up, it's a lot easier. When it's in a micro-layered build-up, very difficult to create that fluorescence in the cervical unless you can do it in a fluorescent stain. And just to be clear, not all this question will probably come up now, but not all the stains that say fluorescence are really fluorescent. So out of 10 stains, let's say you have a group of 10 stains, I'm going to tell you that they all say fluorescent on the jar. Usually 1 or 2 of them are only fluorescent. And those 1 or 2 are usually the stains that are the whiter, brighter stains. Once you add more color or chroma into the stains, they lose the ability to truly fluoresce the way we'd like them to. So be aware of that if you're thinking, well, I put some fluorescent stain on it, so why does it look right? That's why, because if you use the chroma type stain, the fluorescence is so minimal that it almost doesn't detect. It's not detectable in fluorescent lights. So back to the build-up. I don't want to run out of time here. Same thing over and over again. Chroma in the cervical third, that's 1 powder. Value dentin in the middle third, that's the 2nd powder. And then the 3rd powder or the third might be a combination of these 2, or it might be something completely different, depending on what effect I'm trying to create. For those of you who want to do a more simplified buildup, that's fine, as long as your wash bake has given you the things that you want. Heavier chroma, heavier or more value, and then the line angles. If I wanted to do this with 1 dentin, could I? Yes. But what would I have had to do in my wash bake? I would have had to really increase that chroma, because when I put that 1 dentin over it, I want to make sure I get more color out of it. I would have to really increase the value, because if it's the same dentin up and down, I want to make sure what's underneath it is giving me a brighter value. So I could get away with 1 dentin as long as my wash bake gives me all the power that I need to make that work for me across the board. And again, I'm choosing those powders based on what we talked about right from the beginning. How much chroma do I need? Where is the value? And what is the age and the effect that I'm trying to create? Once I've created my canvas, back to the same thing. What kind of mamalons do I want? The patient's kind of young. I want to kind of get some light that's going to penetrate through there. So I want some mamalon-y look towards that incisal edge. And I'm basically going to utilize those materials to let the light pass through to get that third effect. But be clear, when you look at nature, and these are all natural teeth, there is no incisal edge that is exactly the same. Even next to each other, look at these two incisal edges. They're not exact. They're similar, but they don't look exact. These two, they're not exact, right? There are different effects that are happening in all of them. No two incisal edges look exactly the same. And a pet peeve of mine, I think you guys have probably heard me say a billion times, is when a doctor tells you to match the 8 and 9 exactly the same and match the shade guide exactly the same. And I would just say neither of those two things exist in nature. No tooth matches a shade guide, and no two teeth are exactly alike. There's always little nuances in them. And those little nuances are what make things look real as compared to making them look on the faker side. So we went a little whiter, brighter on her. She was a young patient. There was my final restorations on the cast, and then I'm checking my surface topography to make sure I have the amount of texture and light reflection that I want. And once I feel confident with that, then I'll send that back to the doctor. Actually, this case was a little bit of a pressure case because the doctor was actually here working with me, so I kind of had to get it done in one day. And um, maybe not my favorite case under the pressure of not looking at it and not bisque trying it in and all the things that you want to do. Anyway, doctor's going to take those restorations. They're going to clean them. This is what your doctor should always be doing. They could use a Zarcone or an Ivo clean to make sure that there's no remnants after we've sandblasted inside the zirconia crowns. And then most of my doctors are using a Z prime or something before they actually do their final cementation. So this was on the day of when we're cementing the restorations. They look somewhat okay. Again, we'll get some tissue fulfill in there, and then things will look a lot better. I actually like my cuspid better. I feel like I'm a little bulky on these restorations, but I think when the tissue fills in, we'll have a little bit better look on that. And there is the before and the after, and there's a happy patient, and that's really what we want at the end. I could pick on the crowns, as I'm sure we all can, and the restorations, things you want to go back and do. I have to be honest and tell you, I'm really a fan. I know everybody wants to do everything in one day, right? You want to prep it and impress it and put a crown in and go from point A to point Z and have it done. I don't know how good people are that they think they can do that. I can tell you I'm not good enough. And I really want to see my restorations tried in the mouth and make some evaluations because what I have on that cast is not always the same as what it's going to look like in that mouth. And I think if I could go back and redo a few of these, I would probably thin them and change a few little things and little detail things that would make them better for me. But that's the advantage of communicating well with your clinical partners and being able to take the steps in the right way. And those are the things that I'll go through in the webinar on April 30th, one of my clinical partners. So with that said, I think I'm just about, pretty good, James. I try to time these out to be about 50 minutes. So pretty perfect. That'll allow us a few minutes for some questions and so forth. So I'll stop here and say thank you guys for paying attention to another webinar. I'm kind of getting in a roll and how we do these. So it's kind of been fun, and you guys can always reach out to me and ask some questions if you don't get them in today. But I'm sure Jim has a little pool of questions that are coming out. So thank you guys for paying attention, and if you have any questions, feel free to ask away. I think years ago I used to, when I was kind of working on my ceramics, I'm still working on them by the way, but years ago, if you opened my drawer, every bottle had a tab that I made on it, right? That was kind of on the top of the bottle. And the reason behind it wasn't because I didn't believe what the company told me. It was because I wanted to get used to seeing the colors that what they looked like when they were fired. And I really wanted to kind of learn to not just say A1 enamel and done. I wanted it to be what chroma or what value, what opacity do I need to fill that space? And I wanted to kind of change the concept of it. Today, I don't have all those tabs on my bottles anymore because I'm pretty comfortable with it. But I think the key for us to really, especially in this world, because look, much more micro layering, right? Much more small amounts of ceramic that we're using. And boy, if you don't know the opacities and translucency of those materials, your micro layered restoration is not going to look very good.
You actually touched on one of the questions from one of the customers about the tabs. Do you make tabs and tape them to the top of your bottles? And if so, what thickness did you use? Is there an ideal thickness?
Yeah, so I did for years, right? And it's funny because people have come to my office now and they're like, "Hey, I watched your lecture. You said you have tabs on your bottles. You don't have any." I'm like, "Well, I did, but those bottles have all changed over the years." And so when I'm making dentins, I make them in 1 millimeter thickness because that's the average of what a dentin should be. So I can kind of imagine that coloration. And when I'm making enamels and effect materials, usually enamels are about 5/10 of a millimeter, and effect materials I usually make it about 2 or 3/10 of a millimeter, and that's kind of the standard for me. Again, I don't do it anymore. I really feel it sounds, boy, it sounds cocky to say it this way, and I don't want to say it this way, but it's the only way to explain it. I understand powder, right? I've done courses in different countries where I've walked in and people said, "Oh, can you build this powder that I've never seen or heard before?" And I'm like, "Yeah, no problem. You have a shave tab, let me look at it." Why? Because I understand the concept, and the concept is how we design powders to work in certain thicknesses and certain opacities and certain translucencies. And I think the more we share that information, the easier it is for ceramics to understand what to do, especially with all the material options and the changing of materials today.
Yeah, and I think just so that in general for anybody's attending, you can always go to VITA for a factory tour and ask them questions. If you're ever in Germany on vacation, let us know. We'll contact VITA Germany, and there's many people there. You can see how the process of producing portions are and ask them away. Uh, Another question is, some of my doctors want me to high polish the cervical areas of zirconia to prevent plaque buildups. Do you agree with this? Or why
I
wouldn't
do.
you glaze the surface?
Yeah, I do agree. I do agree. So first off, realize glazes have a porosity to them, even though they look shiny. There is a little bit of a porosity to them, especially if you're putting stains in them or not polishing them out afterwards. Zirconia tissue is actually a nice material if it's polished well. If it's just glazed or fired on top of it, it's still a little bit of a rougher surface. You only see that under an SEM scope, right? A high-powered microscope, you can actually see it. So for me, the simple answer is yes. I think polish is better. I would also tell you that when I'm putting ceramic under a pontic or at the cervical, a lot of times I want to over fire that ceramic. So as an example, I did a 3 unit bridge. I have ceramic margins on it, and I have a pontic in the center. When I'm doing my final glaze, I'm actually using maybe a translucent dentin, a TD dentin, mixed with a little bit of a low fusing glazing material. Because what I want to happen is when I put it on that tissue, I want to overfire it and create more of a glassy matrix on that material. And then I'll come back and polish everything around the interfaces.
Okay. And speaking about margins, another question is, how do you communicate to your dentist how deep you want your preps on the margins for ceramics?
Yeah, it used to be standard a millimeter back in the day, and today with minimally invasive dentistry, that's not happening anymore, right? So what I would tell you is, depending on the material, meaning zirconia or metal ceramics, I've done margins in small areas like maybe 4/10 of a millimeter. I can do that. And in truth, the less reductive they are, the nicer it is for the patient, but the nicer it is for you because you need less material, right? You just have to know the material. So a simple answer is I'd like at least 4/10, and I don't think you need more than 6 or 8/10 anymore today. But if it's a full coverage prep, let's be honest, a lot of the restorations you guys see had a crown on them for 20 years. The doctor took the crown off, and now they're just re-cleaning up the tooth. Right? So if that's the case, a millimeter shoulder is fine. But if it's a young patient and you're prepping it for the first time, the less prep, the better.
All right, thanks. And then this is a loaded question, but if there is a single aspect of a tooth, uh, the most important to get the right aesthetic look, what would that be?
It is a loaded question. Contour is first.
So
Contour to
form,
me, yeah, form and contour is really king, right? Because you can get away with a lot if the form, and the reason I say that is because realize form and contour, even if the shade is off, has a similar light reflection. So if the line angles are the same, if the texture and the embrasures are the same, then the light reflects similar, even though the colors aren't exactly the same. After that would be value.
all right. And then on your cores, what you call a canvas, but on your cores, uh, is there a rule of thumb to, like if you have an A2 or a 2M2, is your core a certain level higher in chroma? Like instead of A2, you do it in A3, A3 and a half, even though your shade's A2, or is there any symbiotic?
Yeah, I'm not sure if I'm understanding it the way you're saying it the right way. It's actually the opposite of what I would do. So as an example, let me break the two of them down. First off, substructure, right? Substructure, for me, I'm always pushing value up.
Right.
So if I'm doing an A2, I'm not using an A2 substructure. I'm probably using an A1 or a 1M1 or maybe
Okay.
even a BL, right, or an OM, something brighter and whiter, because that's where I can control the most reflective index and even get some masking. When I go into my canvas, oh, before I get to the canvas, I would then use marginal material, and that's where I might add chroma into the cervical and even more value into the middle third. But when I go into the physical canvas, I can't make the determination of what powder I should use until I make the determination of what enamel I need. So let me say that so that's really clear to everybody. When I'm looking at a tooth to pick shade, first thing I'm looking at is the enamel. What is the enamel? Is it highly transparent? Is it translucent? Or is it slightly whitish and opaquish? And if whatever those three are makes me rethink what I need on the inside. So example is if the enamel on the natural tooth is very translucent and the restoration seems to be A1-ish, I know right away that as I'm building that internal canvas, I'm going to be pushing my values up a lot. Because the minute I cover it with translucency, I'm going to lose the value. So I have to really base it from the outside in, not from the inside out.
Okay. All right, good. I think that helps answer that question. Let's see. I think we've got maybe another. So, what is your favorite finish line to full coverage with metal, Emax and zirconia, lithium disilicate and zirconia?
Favorite finish line for every restoration should be a modified shoulder. So modified shoulder for clarity means you come down the axial wall, you start to chamfer, and then you shoulder off. How much depth you have on that shoulder, again, 4, 5, 6 tenths of a millimeter is probably somewhat adequate today. For lithium disilicate to zirconias, metal, I'd rather maybe be 6-ish or more. But the modified shoulder is the ideal prep for every full coverage restoration today.
And then, do you prefer a brush type of brush that you use for your build up, your organic or a synthetic or a hybrid nowadays, or
That's the loaded question, Jim, because um, I have about 30 brushes on my desk right now that I'm playing with. The hairs are becoming very difficult to get. I was always a Kolinsky Sable guy, and I have a company that I'm working with now and working on some new ones. I have worked with some of the synthetic combos. Harvest makes a nice one, and MPF makes a nice one. I don't love the synthetics, though, I have to be honest, and I'm struggling to get used to them. So I'm looking at some other hair options and kind of work through that, and hopefully I'll have something newer out there soon, but right now it's been a struggle to harness this in the right way again.
All right, and then we'll wrap it up with this last question. We always get it when you mention refractory. So, what refractory material do you use, and how do you seal your refractory model or dies?
So I used to use the GC Orbit Vest. They discontinued that. And I gotta be honest with you, I was really annoyed when they discontinued it. I'm almost happy they discontinued it now because I've been using Shera. And the only challenge with the Shera is I think they're still setting up a base here in the US, but getting it from Europe was a little bit of a difficulty. But boy, a night and day difference. It's beautiful. The powder is fine. It devests. The fits have been great. We did have a little issue recently because we had some outdated powders and we had to rush stuff over. But I'm using the Shera investment, and the only thing that we did change is with the GC Orbit Vest, we were doing a connector paste on the dies. That was a GC material. I don't do the connector paste anymore. Um, Depending on which powder I use, certain powders, especially PFM powders, I can go straight to the Shera dye without an issue. Some of the Zarcone or lithium disilicate powders, I might use a wash of a transparent and just fire that a little higher on the dye as a connector paste. But in general, I'm not noticing much of an issue, especially like if I use VM9 or something, it adapts to it very nicely.
Nice. All right, we did get one last question here, last minute here. How do you like the Mark II milled veneers, and any comments on those?
I love the Mark II milled veneers. I think I tell people from a business perspective, if you're doing lithium disilicate veneers and, you know, you have the option to do feldspathic, they'll look a billion times better. And by the way, if you can mill your feldspathic and micro layer them or not, they still look better than lithium silicate in my mind. I love them. So they're not for every case because, the opacity of the material, if I have a lot of, build up that I have to do, I would go just straight feldspathic. But for minimally invasive veneers, for 4, 5, 6, 7 tenths, I think it's one of the nicest materials. It's probably the most underutilized material out there today. It's really a great material.
All right, that's good to hear. So Peter, thank you very much. I want everyone to know that the today's webinar is being recorded. It will be downloaded onto our VITA North America YouTube channel in a couple of days. Those of you who are asking about CE, we will go ahead and process those with the registration information you have. Peter is going to be with a special guest April 30th. So please join us for Peter's next webinar. That's April 30th, and we will, it'll be interesting to see what the guest is and how you guys handle that. I think it's going to be a team approach. Everyone's interested in that, how to work with their dentist much easier and closer and so forth. So we look forward to that, Peter. So any last minute comments you might have?
No, I look forward to that one myself. It's going to be a fun battle, I guess, there maybe over certain issues. It'll be fun to discuss for real. And I look forward to seeing you. I think I'll see you in May on the West Coast for the LMT show. And I think I'm in a few other states at the same time. So I'll see you sometime in May. And I look forward to being out in Cali. But tune in for April 30th because it's going to be fun.
All right. Well, thank you again, Peter. I'm always learning from you, so I think everyone else as well. No matter how many times we tune in and listen to you, the subject matters are different but interrelated, and they're like puzzle pieces putting all together. So all of the webinars that Peter's done on all the topics are on that VITA North America YouTube channel. So please visit us. Peter, once again, thank you. Thank everyone for attending today. And let me see a question. All right, no more questions. So we are good to go. So Peter, have yourself a good, wonderful day. Everyone, thank you for joining us, and we will see you again at a later webinar. Bye.